Good morning and welcome to the final day of the three-day conference on innovations in epilepsy. I am Trish Cooper and I am the hospital system liaison with UCB. When the Epilepsy Foundation asked us to support them in this event, we were honored. Our support does not end with this conference. At UCB, we strive every day to work for people living with epilepsy through science, education, and advocacy. Our first speaker today will be Dr. Edward Novotny, who will be speaking on the topic of telemedicine. Dr. Novotny is a professor of pediatrics and neurology at the University of Washington and is the director of the epilepsy program at Seattle Children's Hospital, overseeing several epilepsy specialists. Dr. Novotny serves as the chair of the Epilepsy Foundation of Washington's Professional Advisory Board and has served as a longtime member of their Community Advisory Board as well. He also serves on the National Epilepsy Foundation of America's Professional Advisory Board, where he frequently interacts with epilepsy experts across the country. Dr. Novotny received his undergraduate degree from the University of California, Irvine, and his medical degree from St. Louis University. He is consistently listed as one of Seattle's top doctors and regularly interacts with the Epilepsy Foundation of Washington staff to help the organization fulfill its mission. Please welcome Dr. Novotny.
Okay, thank everybody for attending this meeting on a Saturday morning when I'm sure many people would have other things to do. And I want to thank Jessica, Kevin, and everybody for having this webinar. We've had some great sessions that will become available to people after this webinar, after this series is over as well. And today the topic I think is apropos because of the current coronavirus situation regarding telemedicine. So let me share my screen. Okay. So telemedicine actually has been around for quite some time, but because of the current coronavirus pandemic, it really has exploded. And so I want to just go over how we got to where we are now, which is telemedicine is really becoming ubiquitous in many situations, and what can we look for in the future. So I for next, I have no disclosures and no financial relationships to Zoom, YouTube, or any other things related to telehealth or telemedicine. But where has telemedicine gone? And so this is from, people may know from the 1960s, the Jetsons. So this was telemedicine predicted from cartoons and several decades ago. And are we at this point yet? Where is telemedicine going to be in the future? Where is it in its current status? And what have been the challenges for this? Certainly, I actually do telemedicine or something teleconferencing almost every day. And certainly in the current environment, it's been a frequent in the telehealth, not only from an educational environment perspective, but also for patient care. So I think it's important to, before we move on, just to talk about some definitions. So we often use the term telehealth, which is a broader umbrella of a lot of different connections and applications. So telehealth is the use of electronic information and telecommunications technologies to support and promote long-distance clinical health care to patients and professionals, as well as education for both patients and professionals, and also from a broader public health and health administration aspect. I think telemedicine really refers to live video conference. That may be provider to patient, provider to provider for consultations. There are many situations where telemedicine can be used. It can be a nurse to patients and patient family. It can be other providers in addition to physicians. Another type of telehealth that has been used for a long time is sometimes referred to as asynchronous telehealth or store and forward. And in a situation, I'll talk about some of those, where we've been doing here for several decades is EEGs are done remotely in some hospital or some outside clinic, and the data is transferred to our center, and we review those studies remotely and provide the input and the expertise for the remote sites. There's also what's called remote patient monitoring. You can monitor an individual's heart rate, EKG, their respirations, a number of things remotely in the home, and that's becoming increasingly used as part of telehealth. And there's a new and sort of exploding area of telehealth, what's sometimes referred to as mHealth or mobile health, where you have applications, whether it be on an Apple Watch or your smartphone, where you're gathering health information that you can share with your providers and other healthcare professionals, or certainly use it. It's very useful as a consumer or individual. Telehealth has been used for decades from an educational standpoint. This is clearly one of the venues of where telehealth is being used as an educational venue perspective. So what happened and why has telehealth become such a critical point? And I think we know in the coronavirus struck in the February, probably January, as early as January. On March 6th, Congress passed legislation through Human Health Services to waive certain requirements to perform telehealth in Medicare and in more broadly. This waiver was known as 1135, and it was preparedness to supplement the current Appropriations Act. On March 17th, the Human Health Services broadened access to Medicare and telehealth services on a temporary and emergency basis under this waiver and others. The primary indications for this were part of a broader effort, not only through the medical services at the government, but also the White House Task Force to help contain community spread of COVID and protect those at high risk of complications from the virus, and to maintain patients in our country's healthcare. There was a lot of legislation that had to be changed on a state-by-state basis regarding state licensure for medical care, and this was done in concert with these early things in March. So this really led to a rapid evolution and explosion of the use of telehealth in healthcare, but it has really been something that has been used for over decades. So as a result of the COVID, there were tremendous change in hospital credentials. They actually increased, so phone visits were enhanced for reimbursement and payments. The Hospital Care Administration altered what was required from billing and a documentation requirement. The Federation of State Medical Boards sort of enhanced state licensure requirements so that you can see individuals throughout many states throughout the country. There's relaxation of certain what are called HIPAA enforcement. There is also changes in the facility fees related to seeing patients in clinic versus directly in their home. Providers, either physicians or other providers, were able to perform their telehealth visits from their home or from their office. Also, there was a huge explosion of seeing patients who've never been seen in a system via telehealth, or seeing new patients, and verbal consent and informed consent parameters were changed as a result of that. So a number of things had to be changed to make telehealth really usable throughout the country. So I just want to show you what happened here at Seattle Children's between 2019 and 2020. And you can see that actually we've been doing telehealth at a very low level for over decades. And roughly at Seattle Children's, roughly about 100 providers were using telehealth on a regular basis. And beginning in February and March, nearly 600 of the physicians and other healthcare providers began doing telehealth. So you can see the rapid increase in percentage of overall clinic visits and with patients. Actually dramatically increased to over 80% of our visits and communication with patients, excuse me, were by telehealth. So, and this has persisted now, and now to September and October, we're still 50% of our clinic visits in the outpatient setting were in telehealth, and more of that is actually directly to patients in their home rather than in other venues. Excuse me. So this dramatic change occurred as a result of the coronavirus pandemic, but is clearly persisting and is clearly identifying this telehealth is going to have an important role for continued patient care, not only during this current pandemic, but also in the future. So what is that going to look like? So in the past, telemedicine or telehealth has really been focused at rural healthcare because it is well known that in the patients in a rural environment, there's actually a dramatic decrease and they're really medically underserved. So nearly 80% of people who live in rural areas don't have access to certainly specialty care and then the broad levels of care that we have throughout our system. And so that was a focus of telemedicine was in rural healthcare for several decades. And that's how Seattle Children's and many other institutions at the University of Washington and throughout the area were focusing telemedicine and telehealth in the rural healthcare setting. So just to give a little history and background of how telemedicine and telehealth had been used here at Seattle Children's, over 2 decades ago in the early 2000s, we often did a lot of video conferencing between patients regionally in many of our outreach clinics. Seattle Children's goes to a larger area throughout Washington, Wyoming, Alaska, Montana, and Idaho, and we have outreach clinics in these regions. And most of the telemedicine and telehealth was done either clinic to clinic or clinic to in the hospital setting. And so that was the primary focus in the early 2000s and 2010. We also developed a way to have consults by telemedicine, by physician to physician or provider to provider in 2008. But roughly about 2018, about 2 or 3 years ago, we started doing telemedicine directly to patients' home, what's often called direct to consumer telehealth or telemedicine. So patients didn't have to go to an outreach clinic to get telemedicine care. They can actually remain in their home. So that had been in place in our institution over 2 years ago, but obviously it really expanded. And another thing that just happened over a year ago is we have also provide consultations to neonatal ICUs and other ICUs throughout the region by providing consultations to providers in other hospitals. So telemedicine or telehealth has been around, but has really dramatically changed, mainly because of the changes in technology. And then more recently, in the situation with the coronavirus, all the changes in the regulations that have occurred over this period of time. At the peak of the coronavirus situation, where does telehealth fit in terms in the epilepsy community? So in early March or mid-March, a survey was sent out to epilepsy centers. There's a organization called the National Association of Epilepsy Centers who sent out a survey in March, and the results came to about 256 centers. About 90 of those centers completed the survey, and 75% of epilepsy centers who completed the survey identified that they had little to no capacity for doing telehealth, even though it was expected. Greater than 50% of those individuals or those centers, epilepsy centers, who had little experience beforehand were currently using telehealth on an ad hoc basis. They identified several barriers in different epilepsy centers. There was often a lot of challenges on the patient side, who had lack of patients having either telemedicine hardware or software or situations. There's often poor infrastructure within their institutions. Again, the dynamic and constantly changing, evolving regulations and guidelines were difficult to keep up. And there was a lot of variability in the reliability of platforms of how telemedicine or telehealth was doing. And there, early on, there was a concern for bias for certain patient populations. Who is really able to take advantage of telehealth and telemedicine? So there are a lot of concerns, and fortunately, nearly half or a third of this people in epilepsy centers were using telehealth. Again, as part of this survey, what was kind of to reiterate, almost a half of the people at the epilepsy centers either had no prior experience with telehealth or telemedicine, or very limited use only in remote rural areas. So, and at the same time, they were doing primarily live video telehealth or telemedicine visits. A lot of them were just using phone calls to maintain contact and care of patients. But it was really a dramatic change over a month or so. So it took a lot to get telemedicine to be really useful, and a lot of changes occur. So I just want to talk about, well, what really has happened with our current telemedicine visits. So having done this over the last several months, I've had a lot of challenges in different situations. There's often a lot of technical challenges of making connection to patients. But a lot of that is facilitated by our support staff in the clinic. Also, there's a lot of challenges in terms of getting patients enrolled on time. We use a platform that many institutions use called Zoom, which we're using at this point in time, and that is connected to the electronic health record. But at the patient side, there's a lot of variability in terms of their ability to either have broadband or internet access in their system. I've had a lot of patient visits where it's taken a while for them to be able to log on and get good access. I've had patients and families who've been very innovative. Either they didn't have enough broadband or Wi-Fi in their office or in their home, so they drove their car next to a Starbucks or next to a public library and were able to use the Wi-Fi for doing their telemedicine visits directly in their car. So overall, it took a while for patients and families to really get used to using telemedicine and telehealth. And we always had backups, we could always call them, but it really, in many situations, it was really an important experience for patients and families to make a connection, to be able to provide information in terms of how are they doing, particularly in this current pandemic, where they're pretty often very isolated, and being able to have that face-to-face visit by video has really made a lot of impact on patients and families. And so, my experience with it, I think most people have really enjoyed or have gotten a lot out of the telemedicine visits, and it will likely and continue to occur. It'd be nice to have a poll, and maybe people from the chat, how many people in the audience have had experience doing telehealth or telemedicine visits with either their epilepsy provider, a neurologist, or other providers as well. It's clearly an area that's really has changed, and as many patients and their families are getting used to using this approach, are very very appreciated of having access to their medical care. So So we've done a lot of surveys. There's actually been a lot of publications of how is the current telemedicine and telehealth experience being received by both patients and families, as well as providers that are using it. From a patient and family standpoint, they often identify it's time saving. They don't have to take off of work, or children don't have to get off of school, and they don't need to get childcare in families. It also is clearly cost saving. They don't need to travel to a center. They don't have to pay for the transportation or fuel. And or if they're staying here in Seattle, coming from a visit, they don't have to pay for lodging. There's actually been a recent publication of a trial of patients who had a surgical procedure, and they had the option of having their post-op visit either by telemedicine or coming back to the clinic in person and having that visit in person. And so overall, the responses in the survey from this clinical trial that was done, that 95% were very satisfied with that post-op visit being via telemedicine versus 56% having to come back to clinic for that in-person visit. So there are many clinical scenarios and clinical situations where telemedicine is clearly more convenient and better appreciated by patients and families. I just want to show you some data from our experience here at Seattle Children's, not only for patients with epilepsy, for more our broad patient population that we care for here in the Pacific Northwest. So one of the major benefits of telehealth is the savings from mileage and cost. So over this period of time, we've saved over 5 million miles, or 5.5 million miles of patients traveling from, we see a lot of patients from Alaska and the surrounding states. And you can see we save over 5.5 million miles of travel, and certainly the cost of lodging. And also providers, we often have outreach clinics that have to go to five or six cities in Alaska, several in Idaho and Montana. And we saved several $100,000 in terms of travel of providers having to go to these outreach areas as well. So there's clearly a cost saving, both from the patient standpoint, as well as providers having to travel to outreach clinics. So that's clearly one advantage of telehealth. And more importantly, obviously, depending on, particularly in the current pandemic, patients and families having to travel into Western Washington, where there's a high level of the coronavirus, when they return back to their area in other state, they often had to self-quarantine themselves for several days to up to 2 weeks. So that's not having to travel has led to some advantages. From a patient and family perspective, it's actually cost saving for them. It's one less bill. So when you attend a clinic, actually physically attend a clinic, not only you get a bill for the visit from the provider, but usually the clinic you'll have a charge for the clinic visit itself. That includes the care that you get from the nurses, the nursing assistants, and other people at the facilities. It's what's often referred to as a facility fee. And in general, most patients and families really have had a lot of satisfaction with doing telemedicine, and are certainly very willing to try this as an approach. The other aspect of telehealth or telemedicine visits is that patients and families can often include other family members in the visit that would not otherwise be allowed there, particularly in the current coronavirus situation, where we often limit the number of other patients and family members that can attend an in-person visit. But in a telemedicine environment, you can include more patients and their family members to provide information in the visit. So here's a quote from a patient who was involved in a telemedicine visit. Well, you're sitting right in your room on your computer. how more convenient can that be? And you don't even have to take a shower. I mean, you can get up on the computer, talk to the doctor, and then go back to bed. How more convenient can that be? So certainly there are some benefits and some satisfactions from the patient and family perspective. From a physician or provider, healthcare provider's perspective, I think there's been some satisfaction with that. There's often decrease in time and effort to see the patients. It's convenient because we can often do our telemedicine visits, not only from our offices, but also from our homes. There's often more visits in general. We're more on time. There's no waiting in the waiting room in general. There were less no-shows. The visits themselves were often more productive and shorter or on time. And about 80% of providers identify that from a healthcare delivery standpoint, that the healthcare alone was very similar to an in-person visit. But however, there are also some disadvantages from the viewpoint of a provider. Many providers say it's not the same. Having that face-to-face and visit with a person in person, it's really not the same thing, but it's somewhere in between. And greater than 80 surveys have shown that greater than 80% of providers, either physicians or other healthcare providers, prefer the inpatient visit or in-person visit over the telehealth. And it's certainly very often very difficult for certain patient populations and certain specialties, particularly when they have complex medical problems, that telehealth and telemedicine are not right for everybody, both from the perspective of the patient and their family, but also from the provider's viewpoint as well. So from the standpoint of a telemedicine or telehealth visit, I think there are a lot of advantages and disadvantages. But as I mentioned, there's other aspects of telehealth that is not only the video visits as well. So there's a component of telehealth that's particularly appropriate for the epilepsy community is what's often called asynchronous telehealth, where we can perform EEGs either at outside clinics or outside hospitals, and that EEG is recorded locally. The data is transmitted over the internet and reviewed by providers have higher expertise in reviewing those kind of studies. We also do remote continuous EEG monitoring in some clinical situations as well, and can provide input and care for patients and families in other either outpatient clinic setting or in other hospitals. We do this very frequently at Children's Hospital in outside neonatal ICUs and provide continuous EEG monitoring in the newborn in certain situations. Also, as part of telehealth, there are actually a lot of commercial companies who are now doing continuous EEG or either brief EEGs or ambulatory video EEGs in patients' homes. So that's another aspect of telehealth that has grown not only in this pandemic, but really has grown because of the advent of new technologies for patients and families. And this is a resource that's just beginning to explode and grow. So in the epilepsy community, I think the ability to do EEG remotely and in both in their home and in other more locally has been really an advantage and has really grown during this current time as well. There's another aspect that has actually been going on for some time, not just related to this pandemic, but what's often referred to as remote patient monitoring. And there's a lot of new technology that has allowed us patients to wear what are often referred to as biosensors. They're wearable devices or some applications on mobile phones. It has been used in sleep for some time, where sleep clinics can monitor patients' pulse oximetry, their heart rate, their respirations remotely in their home, and that data can be transmitted to their healthcare facility. It's also been used in cardiovascular patients with cardiovascular problems where EKG and blood pressures can be continuously monitored remotely in patients' home. And are we now looking at, can the data that we get from seizure detection devices be integrated into this remote patient monitoring? So there's a lot of new technology where this is under the broader umbrella of telehealth. So again, I'm just showing you some data that we have been doing, what we refer to as asynchronous telehealth, or doing remote monitoring for a number of procedures here at Seattle Children's. Obviously we do EEG, a lot of cardiovascular studies such as EKG, cardiac echoes are done more broadly remotely throughout the Pacific Northwest region as well. So having gone over the different scenarios and types of telemedicine and telehealth, what's the future of this? And what are the questions that we need to answer to move this forward? And so is telehealth, is it effective? Does it really provide quality care? And we need to closely monitor that. Are there going to be cost and savings that I kind of described before? Will that persist? Is it going to be accepted by patients and their families, and also the providers that are giving this? Are there any risks to continuing telehealth, particularly at the level that we're doing at this point? And then more importantly, is it equitable? Is it available to everybody who really needs this care? So, and clearly, as we have used it in many other institutions, there are currently challenges and what's often referred to as the digital divide. And because many, particularly depending on where you are and many other factors, who is getting telehealth? And usually it's people that have access to the technology and have higher incomes, that have more availability and access to that. We also know that in recent data that only 162 million of people in America do not have access to broadband directly in their home. And 21 million people lack access to really high-speed internet that's often necessary for telemedicine visits. But there are many ways to improve this. Devices are changing, and obviously now in the current environment, a lot of telemedicine is done on mobile devices, which was not really available 5 or 10 years ago, and really we didn't have the bandwidth to be able to do that. There are many programs and institutions that are subsidizing to provide devices to patients and families to have access to telemedicine. And there are many creative alternatives that are evolving in the technical world. I think internet access is potentially being subsidized in certain regions. It's governed by a lot of state and local regulations to provide these services as well. And in the future, is 5G or higher level mobile technology going to be able to allow us to do telehealth through mobile phones? So I think there's still challenges. We really need to pay attention to this, what we often identify as the digital divide. There are also a lot of challenges, not only from individuals in terms of what both their backgrounds are and then what their ages are. So this is a recent study from the University of San Francisco, and you can see who are the people after this recent telemedicine explosion who have really taken the most advantage of it. And you can see by ethnic background, so there was this really big explosion primarily in Caucasian or non-Hispanic whites who really took advantage of the telehealth. But if you look at Latino, Asian, and Black or African American backgrounds, there is very little change between the use of telehealth before and after this pandemic. Age is an important aspect as well. So if you look at people older than 65, there was really actually a decrease in use of telemedicine after the implementation of or this recent pandemic. So there are a lot of other things that affect people's access to this telehealth and telemedicine technology that we really need to pay attention to and give people the appropriate access to these technologies. We know telehealth, though, has, and there's been, again, it's been over a decade or so, a couple decades, that it really has advanced a lot. It really has increased access to health services in communities and areas where patients and families did not have access to specialty care. There's been a lot of studies show that it's been cost effective. It really, more importantly, it can enhance educational opportunities for patients and providers. There are actually some studies that it actually has improved healthcare outcomes by being able to more closely monitor patients in their home situation. This has led to some studies in some patient populations, better quality of care and quality of life, and enhanced social support. I think that enhanced social support is really critical this day and age, particularly in their current coronavirus pandemic, and being able to have that face-to-face contact with, even through video and telemedicine, without exposure to the current infectious diseases is really, really important. So I think in the future, really, telehealth is really here to stay. I think the technology has exploded. It's going to continue. I think it'll continue to be integrated with in-person visits. I think telehealth will really become an expectation, not only from the patients and the family's perspective, but also from providers. A lot of it will depend on will telehealth continue to maintain some cost parity compared to in-person visits. A lot of legislation, a lot of regulations have to be changed in the future to allow that to occur. Again, telehealth is really not an option for some patients and certain specialties, but I think telehealth, for a lot of different reasons, is really well suited for the epilepsy community and can be easily integrated with in-person visits and telehealth visits. So the future of telehealth is really now. What's going to be the future? Are we going to have a virtual hospital? I think, as I mentioned, mobile health or mHealth is really exploding. There's a lot of new technology. Obviously, people with diabetes are being able to monitor their blood sugar and provide that information. Certainly, there are apps and technology to monitor seizures and provide that information to data as well. Here's an example of a mother taking a picture of a child's eardrum through their smartphone and being able to transmit that information to their provider because of the concern of an ear infection. So there's a lot of new technologies that are continuing to grow, particularly in the mobile health region. And this is one of the features of telehealth and telemedicine that will really continue to have this as a strong component of healthcare for patients with epilepsy and a broad range of clinical problems. So I think the future is that we can't not do it. We'll continue to do this. I think telehealth has advantages for certain specialties. I think, as I talked about, and the epilepsy population and community is important. Current and future, this will be important now during the current and any future pandemics. I think regulations and reimbursement and a number of things are improving. There are many regulations at the state and even at the federal level that will really be needed to make this to continue. As I mentioned, there are many technology advancements that will are ongoing, but we also need to pay attention to some of the challenges that are occurring and promote both advocacy and research of, is this telehealth and technology really beneficial to patients and their families, as well as the providers that are using it. Thank you for your time. If you have any questions, follow up with that. Thank you.